Hi, it's Warren Whitlock here, and we're going to talk today about gene therapy. What's going to happen in the future? Are you going to live forever? What about all this genomics and stuff we keep hearing about DNA? Is that going to help us? Today on Emerging Technology with Warren. Okay, let's take a look at gene therapy and see what it can do to help you and me. In the old days, back when the century number started with a 1 in the 20th century, there was lots of talk of what DNA was. We have to remember that before all of us were on the planet, people had no idea what DNA was. And now we see the DNA with the strands that weave together like a ribbon, and we talk about 23 chromosomes and X, Y, and X, and all those kind of things. That none of that was talked about when I was born in the 1950s. And over that time, there's been a whole lot of research done, a whole lot of money spent. In about the year 2000, early 2001, I believe, somewhere in there, we finally had the announcement that they had been able to sequence the genome. And a genome is just another way of talking about the genes. And by the way, just the usual disclaimer, I don't give medical or financial advice here. I am not a certified, trained, licensed expert on any of this. I've just been around a while, and I spent a whole lot of time studying these things. In this case, decades I've been following the research about DNA. And up until 2000, it was pretty boring with all the science of what might happen someday. And that changed about 25 years ago when we were able to sequence a genome, which meant they were able to go out and look at the letters that make up your DNA and see what they say. And these are billions of points of data. Everything is 4 letters. Boy, I'm not going to give it an attempt right now. I'd probably get at least one of them wrong. But there are 4 letters, and just imagine an alphabet of 4 letters, and that allows them to make billions of combinations. And I say they, like scientists are going to do this, but they may someday. But really what they were doing at first was making sure they could see all of these. And so when you hear about the crime being solved by DNA evidence or things like that, they're looking at for some of the matches on some of the scales of what they look at, but it's not everything, and it's completely individual for people. Twins are very close, if not the same, but it can tell what family you come from, what tribe you come from, things like that. And that's the popular stuff, which I would imagine you probably have heard of before. But the difference happened in the last, say, 4 or 5 years when we really started seeing the ability to edit that and making some changes to it. And then we'll get to the big changes here in a minute. But the big one that we hear about is CRISPR. That's CRISPR. It's also called Cas9, as a variety of that they were doing. And essentially what this can do is go in and edit part of your DNA. So if you have a gene that's especially bad, they can cut it and insert the right letter sequence in there. And they do this. Sure, it's not scissors. It's not easy. There's chemicals involved, and there's a lot of science and a lot of testing that went into this. It's not Frankenstein. They're not adding a long trunk. No, this is my natural nose. And they're not adding wings so you can fly. That's in the same code, but that's not the kind of things we're talking about right now. About really bad diseases like sickle cell anemia, which essentially has been cured for enough money and time. They can figure out how to take a person who has sickle cell anemia, who is constantly sick from that and constant daily pain, just a horrible disease, and be able to turn that off and fix the genes so that person doesn't have that anymore. What a wonderful thing. I just was listening to a podcast with an expert on this talking way above my head, and I'm sure just about everybody. They weren't sure about what they were talking about. But one thing stood out that I want to share with you is that pathogens have been what they've been looking for. In other words, the sickle cell anemia, the birth defects, and things like that. What could they fix? It turns out that's just a minute drop in the bucket compared to what could be done. And what could be done is when we get into the larger things going on inside every one of your cells. And that's the epigenetics, which is code that's used to repair the DNA. So it's the code for the code. And the mitochondria, which is where the energy in your cell comes from. And they said, and it even has genes. Your mitochondria has genes. Wow. That's a whole lot of code. That's something I know about. Computer code, bits, ones and zeros, and quantum when we get into things between 1 and 0, or 1 1 0 0 0 1 and 1 0, all being a state of a single bit or a qubit in quantum. But in our cells, there's so much dense information in there that one, you could take this and string it out and it would go to the moon and back, or halfway to the sun, or some measurement like that, astronomical measures of how long these things would be if you had to line them up. And they were really like life size that you and I could look at and understand. And it's all packed inside each and every one of your cells. They're now looking at treatments where for just about anything. Today I heard about autism. I am not an expert on autism. I'm pretty sure that it's not caused by vaccines. The science on that makes sense to me, that there's no correlation. They've done enough testing now, prove that. But is there something to what causes the autism? Yes. And they're finding more and more. And one of the things that we're talking about is just a certain supplement that could be given to a person that has that tendency, and it would allow them to go ahead and change the epigenetics of what's going on in their cell and change the code so that they were healthy. And when I followed what they were saying, again, they're over my head. I'm not going to try to explain what that is, but it made sense that, oh, I see how that can work. And so the question came up, why haven't we seen more of this before? We've been waiting for this as long as we've been waiting for flying cars. And the answer is we've just now been able to do that. Only in the last few years, as the cost of being able to sequence the DNA, which is what we did to the breakthrough 25 years ago, was they did it for one person, one set of DNA, and they spent, I think, $3 billion on it. That's a little bit expensive to do that to everyone in your family. I can't cover that bill. I don't think many of you can. But they got that down to where it was $1 million. Still very expensive. $1,000. $100. And now they're down to 100 and sub 100. It seems very possible to me that we're going to be able to take a drop of blood or another source of DNA from a throat swab or something like that, and be able to get a test and get that as fast as we're seeing tests like the COVID test, where within minutes, whether somebody has that. Yesterday, my wife, who's had some symptoms of flu and we're looking pretty bad with bronchitis, didn't know what to do, was talking to her doctor. Doctor says, why don't you come in? She says, I'm too sick. I can't come in. This has got to stop. And it turns out there was somebody who could come to the house, and all without me knowing this is all going on. I see these people arrive and they're doing a test, and one of them took a swab from my wife's nostril, stuck it on a little piece of plastic. Looked to me, I guess they were adding some substance to it, some liquid, and then within a minute or two was able to say, here, she has flu A. Apparently they've run out of names and they're now using letters. And she said, yeah, you can go online and see what flu A is. We didn't, because they explained to us that she had a touch of flu A, and some of the things that the doctor was saying she might need, she might not need. Don't take antibiotics. Instead, do this treatment, and miracles of modern medicine. That combined with the study, my ongoing study of what can be done with little or no invasion, is very heartening. The therapies become much broader. One of the things that happened during the COVID vaccines and looking for treatments for that is they developed something using mRNA, which is also there with the epigenetics and whatnot. Again, please don't trust me if you're taking a test on this stuff, don't trust my explanations for which definition is which. But in practical terms, the mRNA or the RNA of your system is that epigenetics, that ability of your cell to rebuild itself and stay healthy. So there's only a few things the cell can do on its own. It can stay in place with the other cells and allow your body to function. It can repair itself in some ways, and then ultimately it can die. And you have cells dying all the time. That's what dead skin is when you see it. That's what hair is that you cut and it grows again. Those are all things that are cells being replaced, and that happens all throughout your body. So whatever is in your bone marrow or your bloodstream or whatever, those cells are replaced constantly. And so the live, repair, or die, it's pretty much all a cell does. And then when it's living, it expends energy and does whatever. That's biology far beyond anything I understand. But if we keep these cells healthy, we can do a whole lot of things. I'm studying it a lot because of longevity. I am convinced that we don't have to get sick and stay sick for many years and ultimately die from that. I am at a blessed age when I can say I've had a good life and not looking to become immortal, at least not at this point, although I've been immortal so far. But what I am looking at is how can I stay healthy for the longest period of time? And in studying that, find out that we can all stay healthy for a lot. So here's what's coming. As we find out ways to change just a little bit, instead of a shelf full of 100 different supplements that I have to take, which is what I put together for me, they're finding that some of those are bad. One was they were talking about folic acid being a good thing to take, recommended for pregnant women, recommended for children, I think sometimes. And I had it recommended to me, and it's in vitamins and it's in all the cereal and flour. It's an additive. And this explanation I heard today was you need something that's a little bit different. And I'm not even going to try to give you the name because please don't be looking up things I say. But it's the theory in changing that, the folic acid, which has become an inhibitor, allows the other thing to work and can actually cure things. And that's when they were talking about things like diseases, Alzheimer's ones I should be thinking about today. The one we were talking about before, which is autism. Autism, Alzheimer, close enough. But anyway, the symptoms of autism were being cured. So we've got a couple of layers here. We've got the genetic, the CRISPR technology, being able to change genes, and then all these other things in your cell, making your cell work better to repair itself, which seems to me to be the natural good thing to do. And then ultimately, which things are going to help you get rid of the dead cells and replace them with good cells, have better growth that way. And if you do these things, aging, the disease of aging, of getting less and less energy, less and less ability to do things, and diseases that last for decades and kill you, all will be gone. All the major diseases we're on the cusp of doing well. This is before we get into AI. And I just want to wrap this up with the idea that when we start applying the vast research that AI can do, it's no longer can we get rid of a few really bad diseases. Let's take a look at every disease there is, every chronic condition there is, and every way you can improve and optimize your system and see whether or not there's something that can be done. And then not just can we make it so that a handful of supplements or not, or whatever it is I'm taking, doesn't become something that's just that we recommend because we know in studies a lot of people could use it. It becomes something that we can say prescribe to one person. And I know this to be true. I know in the 100 plus different substances I've tried over the years that a lot of them I don't see very much difference on a short-term basis. I see I'm taking several that help me maintain a healthy blood sugar level, and it's doing better. Nothing as good as stopping the consumption of sugar, but a whole lot of things that can help and help me not have spikes and deal with the diabetes. And sure enough, they're now talking about things that'll just change that. But more important, should I be taking 8 different supplements that are supposed to help me maintain a healthy blood sugar? Or would it be one or two and maybe taking more of it that works better? That's what the AI is going to be doing. I'm on a personal quest. I'm going to take a look at all these things I've been using, see if I can scan them all into ChatGPT along with my blood test and saying, hey, what do you see? And have it come back with some recommendations. I'm not suggesting diagnosing or prescribing anybody do anything like this for a cure, but the cures are coming. The scientists, the doctors, the smart people who have spent another 10 years in college past what I did, or residence programs and done studies and worked in labs for 30 years. I trust those people. They're working on this. A lot of them that we see in the medical systems we have are doing the best they can to keep up, just as all us humans are. But there are a few people where the researchers have time just to delve into how can we find this one gene and fix that. We need more research being done like that, and we have it. That's what specialized AI programs are going to be doing. So it's looking very positive for what's going to come. One thing I know is I'll be here next time explaining what I can about emerging technologies and how they lead to a more abundant life and longer life for all of us. So stay tuned here and keep listening for another Emerging Technology with Warren.